Welcome to Nursing Pharmacology. This is the first lecture of the first learning plan. These videos will be broken down into 15-20 minute segments so that I don't overwhelm you all at once. These lections are created so that you watch these before you come to class, so when you attend the live lecture, you are ready to go, ready to participate, and ready to ask good questions. I'm not going to try to kid you. I'm not going to be able to give you 100% of all the information you need in these video lectures. But I hopefully will give you enough information that makes you ask good questions in class and allows you to participate fully and dig into the reading materials with some knowledge so that you can fill in the gaps, because I can't give it to you all. You have to be an active learner, and you have to be actively involved with getting your own information. So that's a little bit there. And by the way, my name is Trevor Loreen. You'll see me in face-to-face classrooms, and in the first meeting, we'll introduce each other and kind of get to know one another. But I've been teaching at LTC now for over 6 years. I've been a nurse for 18, a cardiac nurse, critical care nurse, emergency nurse. Passed a lot of medications in my life, and will hopefully pass on some knowledge to you while doing this. These video lectures will be short, 15-20 minutes per section, but there might be 3, 4, 5, 6 or more sections per lecture. Listen to them all, watch them all. Since they'll be on YouTube, you can listen to them on your handheld devices, your computer at home, whatever you have. So that's kind of where this is all going. So, nursing pharmacology. What do we mean by pharmacology? Well, remember, anything that ends with ology is the science or study of. In this case, it is the science or study of drugs. What do we mean by drugs? Are we talking like marijuana or aspirin or morphine? What's a drug? A drug is any chemical that affects the physiological process of a living organism. That's it. Any chemical that affects the physiological process of an organism. Think of a chemical that doesn't affect the process. There isn't one. Water could be considered a drug. Oxygen. And in both cases, not enough water, not enough oxygen, or too much water and too much oxygen can have adverse effects, just like any medication. Now there's over-the-counter medications and prescription. And over-the-counter will be abbreviated OTC whenever you see it. And what do we mean by over-the-counter? It means a medication you can just go out and buy. Just buy on your own. And between 1975 and 1994, 30% of all the medications that were prescription are now over-the-counter. Over-the-counter medications is 60% of all the drugs that are being sold. That's 2/3 of all the drugs you can buy at Walmart or Festival Foods or wherever you happen to shop. Now there are 4 sources for drugs. Remember, when we say drugs, we're talking about any chemical that can affect the physiological process of a living organism. So 4 areas that you can find drugs: animals, plants, minerals, and synthetics or laboratory created chemicals. And I know there's a lot of people that have strong feelings about laboratory created things. But to be totally honest, if we didn't have laboratory created chemicals, we would not have the life we have now. There is nothing inherently evil with a synthetic molecule. Sometimes that is the only way of creating something that we need. So we'll talk about more of those in a moment. Now, for an over-the-counter medication, what is required to be an over-the-counter medication? Because, I mean, what makes aspirin, Tylenol, ibuprofen, Claritin, and Prilosec allowed to be over-the-counter? Well, first off, they must treat conditions that are self-diagnosable. Headache for Tylenol or fever. Heartburn for Zantac or Prilosec. Allergies for Benadryl. diphenhydramine. And by the way, I'll be referring to medications by both their generic names and their brand names. And I'll try to do that whenever, in both situations whenever possible, just to make it as clear as possible. Most doctors are trying to go with generic names whenever possible. Like Benadryl's generic name is diphenhydramine. However, most patients and customers and consumers know them by brand names. So we need to know both. Benadryl is over-the-counter, used for allergies. When I get near a cat, if I touch the cat and touch my face, I'm going to break out in hives. So I need to take my Benadryl. It works. It's self-identifiable, though. It must be effective. You know, if it's not effective, it won't be sold over the counter. It shouldn't be sold anywhere if it's not effective. There's a low potential for abuse. Not no potential, but a low potential. Think of Tylenol. Is there any potential for abuse there? Actually, there is. If you take too many Tylenol, you're going to be in trouble. We're going to talk about that in a little bit. Other things. Robitussin DM. The DM is dextromethorphan. And that does have an addictive potential to it. Sometimes kids will buy Robitussin DM and get their highs off of that. So, you know, even if it's over the counter, they still can be dangerous. Limited drug interactions. Limited interactions with these medications. So if you take a Tylenol and an ibuprofen and a Benadryl, it's not really going to do anything. It's not going to have an additive effect. Whereas if you took a Benadryl and, say, hydrocodone or Vicodin, that will have an additive effect. And any adverse effects are not necessarily bad. For example, going back to that allergy thing with my face is full of hives now because I touched that cat, and so I'm wheezing, I can't breathe. I take Benadryl. What does it do? Makes me drowsy. That's not really a bad effect, is it? I mean, I shouldn't drive when I take Benadryl, and I certainly shouldn't go to take an exam while under the influence of Benadryl, or I shouldn't go to a job interview while having taken Benadryl or NyQuil. But it's a predictable and not necessarily a negative reaction. Now, herbals are a little bit different. Herbals are not tightly controlled by the Food and Drug Administration, or the FDA. They're considered a supplement, so sort of like a food, but not really. And they're not really medication, but sort of are. They're in that very gray zone. But the key thing here is they have no standards for safety or efficacy or quality. So you buy that bottle of echinacea or St. John's wort or melatonin or fish oil, you might be getting what it's labeled, you might not. And there's no oversight to prove that. So that's one of the downsides of supplements in this country. Now, there are 4 types of medications or drugs. Let's use that. 4 types of drugs. There are prescription drugs, over-the-counter, dietary supplements, and illegal drugs. Now, when you do a complete history of your patient, you need to ask some very specific questions. Now, and as you get to know me, you're going to discover I expect specific details when you work with me. So if I'm your patient and you come in and do an interview on me, do not say, what drugs do you take or what medicines do you take? Because I might give you only some of the answer. You should ask, what prescription medications do you take? What medications over the counter or non-prescription do you take? What supplements? And then get more specific. What herbs, vitamins, minerals, and other supplements do you take? And lastly, what illegal drugs do you take? You don't have to list those just because generally people know if something's illegal. They know what it is. But you have to ask because illegal drugs can have a very profound interaction with other medications. You need to know all that stuff. So as nurses, if you haven't already, you will be asking very personal questions, very focused and detailed questions, and you have to get over it. You're going to have to ask those questions. Are you going to be comfortable asking a person, have you used illegal drugs lately? Or have you ever used illegal drugs? But if you don't ask that question, you're not going to get that information. And that information could be really important for providing the right care. Now, the role of the Food and Drug Administration, the FDA, it is responsible for overseeing foods and drugs, right? That means everything from hamburgers, hot dogs, and chicken to Tylenol and blood products and everything in between. And cosmetics, too. Honestly, not sure how cosmetics got involved with food and drugs, but they're there. And I don't get how the government does the things it does. I don't know too many people who do get it, but just understand foods, drugs, cosmetics, medical devices, biologics, and blood products. And biologics, we're going to talk about that a little bit later. Now, in the case of supplements, FDA does almost nothing until there's a problem, in which case the problem has already happened, so that's not good. I'm thinking back to when ephedra got to be a real big deal in terms of a stimulant, and then people started using ephedra to create things like crystal meth, and that's bad. So now the FDA got in on ephedra, and it's starting to crack down somewhat. Over-the-counter safety, again, the consumer must be able to self-diagnose the condition they're treating. They must be considered effective, and the benefits must outweigh the risks. So let's talk about some of the risks. I mentioned Tylenol. If you take too much Tylenol, you're going to have a problem. And that's true. If you take too much Tylenol, you could die. Simple as that. You overdose on Tylenol, you will probably die. But if you don't overdose on Tylenol, if you take the correct amount, you will also you'll get rid of your fever, you'll get rid of your headache, you'll get rid of other pains with very few side effects. So the benefits outweigh the risk unless you take too much. Safety profile, the over-the-counter drug must have a limited interaction with other drugs. Low potential for abuse, not no potential, but low potential. And they have to be essentially effective. Now, herbs are another whole can of worms. When we meet for class, I'm going to ask how many of you take an herbal supplement, and I hope people answer honestly, because I do sometimes. Sometimes I'll take a melatonin when I just need to calm down and go to sleep at night. Herbs can have many toxic reactions. There's many drug-herbal interactions. So herbs can cause a lot of problems. You have to be very specific on what you're taking, why you're taking it, and what potential interactions there could be. 70% of patients will not admit to using herbals unless you specifically ask. So you have to ask. And so don't just say herbals, because they'll say, well, I use oregano on my pizzas. No, be very specific. Do you use herbal supplements, vitamins, minerals, or other supplements? Be specific. And there's not much published research that covers supplements. There are some, but a lot of them are very questionable. So I'm going to take a break at this point. We're going to come back and talk about the administration of medications in the next part of this lecture. Remember, each of these are going to be about 15 minutes. So come back for part 2.